Welcome to our online meeting. I'm Johnny Adams. Today is Saturday, March 23rd, 2024. We're handling this meeting a little bit differently. The attendees are expected to have watched a video by Dr. Bill Lawrence on the topic of peptide bioregulators, Khavinson Peptide Bioregulators. And in case you're coming into this video without having watched it, it is available on this YouTube channel, and it's probably right next to or very close to this one. So take a look at that first and then come back. The intention of this video is to answer questions that you might have after watching the rather lengthy video. We just don't have time in our regular meetings to cover everything that's in the first video. It's rather lengthy content. So that's why we're doing it this way. It's different from our usual format. My own personal experience with the Khavinson peptides that I received from Dr. Lawrence, after about 12 months, maybe 14, I forget, my DNA methylation age reduced by 2 or 3 years, maybe more, I forget. I was at about age 69 or 70. My initial telomere age was 50. After about 12 or 14 months, it reduced to 29. And I might add that I was on a very busy travel schedule. My life was upended. My eating and exercise habits were not what they were before. But I attribute that to the Khavinson peptides. And two people who I've introduced to Dr. Lawrence who began taking the peptides have reported back to me very good results, very good solutions to their personal situations. I'll just put it that way. So I will now turn the meeting over to Dr. Bill Lawrence. We'll start with Walters. He's regular here. Why are we not seeing a spike in supercentenarians, what is it, in Russia, given their extended usage there?
Okay,
Bill?
before I answer that specific question, well, let me actually address that. Not a lot of Russians are using peptide bioregulators, even though you can buy them over the counter at a pharmacy without a prescription in Russia. It would be far less than 1%. I mean, it would be 0.00001 are using them. Where they're used extensively, of course, is at the St. Petersburg Clinic and the Institute there. There is a medical clinic part of the Institute, and they treat individuals, both Russians as well as foreigners who come in for specialized treatment, particularly for retina issues, macular degeneration, RP, and so forth. But the average Russian does, and the average Russian doctor doesn't really know about or use these peptide bioregulators. It's not like in America where every conventional doctor is educated in, lowering cholesterol by statins and so forth. And so, 98% of the conventional doctors are familiar with it, using it. It just isn't there in Russia. But let me also add something. I'm not an expert on peptide bioregulators. Okay, I've been working with Khavinson. He's been my mentor for the last 10 years or so. My narrow focus has been administering these two clinical studies, the telomere study and the DNA methylation study. We use those as proxies for creating longevity. And what I'm referring to, for those of you who have watched the videos, you'll recall that Khavinson and his team of scientists did what I call a series of old people studies back in the 90s. And their results using the peptides were just nothing short of phenomenal. In one of the older age groups that I'm now in, I think it was 75 to 85 or something like that. They were able to reduce the mortality rate over a period of 6 years from, I think the control group, non-peptide, had a fatality rate of 88.1%. The group using just 2 peptides, and there's now 21 of them, but just using the 2 peptides, the thymus and the pineal gland, had a mortality rate of 33.1%. I mean, that's just phenomenal. And so what we're doing with these clinical studies is simply confirming the Khavinson Russian studies that were done decades ago, and doing it here in America. And it took me better the part of 2 years. I don't want to use the word convince, but it took me 2 years of discussions with Khavinson. Khavinson is one of those people you don't convince; you simply provide data and information, and then they make up their mind. It took me 2 years to get him to agree that we should do a clinical study here in America. And the reason he finally indicated that he was willing to do that is that the clinical studies that have been published for decades in Russia were basically unknown outside of Russia and outside of Europe. And what I think motivated him was, for all of its faults and everything else, American clinical studies has, I think, more credibility globally than most other countries. And so for us to be able to eventually publish a clinical study showing a reduction in mortality based on these proxies that we're using, telomeres and DNA, was something that was of interest to Khavinson. But going back to my original statement, I'm not an expert on peptide bioregulators. I've been using them for 10 years, primarily with respect to these proxies for biological age. The doctors who are enrolled, we have primarily doctors in the clinical studies, they use them for their patients, and I get feedback from the patients in terms of kidney labs, liver labs, and things of that nature that confirm that the peptides are very effective for organ regeneration. But what I want to make clear is I'm not an expert by any means at all on peptide bioregulators. What I know about are these 2 clinical studies and the results that we've been able to achieve. Johnny, I'll turn it back to you.
Miles has a question. What about subcutaneous injections as opposed to capsules?
Okay, I'm not sure I understand the question. If the question is generally that are the injectables more absorbable, of course they are. Okay, do we use them in the clinical study? No, for obvious reasons. It would be difficult to administer the clinical study with 140 people, even though most of them are physicians, using injectables. What we do is we use only the oral capsules, only what we call the natural peptides, or we refer to them in Russian as cytomaxes. They are the natural extracts from the animals. There are actually more than 55 different peptide bioregulators administered in sublingual, administered as injectables and capsules. We, of course, chose only the capsules because of the ease of administration, and because if we had tried to bring in say injectables, we would run afoul of the FDA instantly. They would classify them as drugs at that point. And so we've had no problems at all for what I guess we're now 8 or 9 years into this with capsules. And all of the results that I show in those YouTubes in terms of the lab results are solely based on oral capsules. And the reason they're effective, of course, is that those oral capsules containing the bioregulators are basically 2, 3, and 4 amino acid strings. And so they pass through all of the hormones, including the blood-brain barrier and so forth. But that's why we don't use the injectable form of it. They do use that as a treatment option in Russia at the clinic.
Okay. Next question from Miles. And do your cocktails, he says, do cellular reprogramming?
Yes, that's exactly what they do. At the cellular level, they are reprogramming. Then as a result of that, we have tissue regeneration. As a result of that, we have organ regeneration. And where we see that in the short term is, for instance, with the kidney labs, the thyroid labs, and so forth, that the doctors, where they're using them for their patients, I get the feedback. And what I typically see is within about 6 to 8 months, if someone's say in stage 3 kidney failure, we see an improvement. The same thing with liver, the same thing slower, like in 12 to 15 months with RP and the other retina issues.
Okay,
And
and
and the
to
and
that
the
I'll.
I'm sorry, and the
Mhm.
proof is the proof. Well, I can't show the proof because it belongs to the doctors that are dealing with the patients. But the proof for me is the doctor sending me the labs, but that is not the primary purpose of what we're doing. Of course, we do that as an adjunct to the clinical studies.
Very good. Well, to that I'll add, I have heard that cellular reprogramming is synonymous with resetting the epigenome towards youth. Maybe someone here who knows more about it can correct what I've heard, but an evidence of that is the reduction in DNA methylation age.
Hmm.
That is one way to measure resetting the epigenome.
Absolutely.
So, yeah, go ahead.
And we have a significant amount of that kind of proof in terms of the bioage markers. We're now using True Diagnostic for our methylation testing and so forth. And I think Ryan Smith told me, I think I've ordered 220 test kits over the last 4 or 5 years. And the proof of what you were just talking about, Johnny, is that we continue to see very positive results in terms of the biomarkers improving, in terms of all the methylation markers that True Diagnostic is looking at.
Okay, Miles, next question. What about cancer peptides like lactoferrin nuclein and PEP27?
My answer is what about them? They're not something that we're using in the clinical study. We're using just the 21 natural peptides.
Okay.
There's now
Uh,
it's estimated there's probably 1,000 peptides out there, most of them the synthetic version and so forth. It's become a world explosion in peptides. Our focus is on the 21 that we use in the clinical study.
okay. And he asks, what about adding small molecules like the rejuvenation cocktail of Dr. Sinclair, which included valproic acid, Repsox, and phoscolin?
Yeah, that's a fascinating protocol. It just is not part of what we're doing. Our program is to show that using these 21 bioregulators that we can improve the proxies, the telomeres and the DNA methylation. Ultimately, underneath all of that, what we're doing is doing tissue regeneration, organ regeneration in order to be able to get the mortality reduction that Khavinson showed in his published clinical studies. The reason that we use telomeres and DNA is we can measure those things. And our goal is not to be able to show that we've reduced biological age. Our goal, and I keep coming back, telling the people, reminding them of this, our goal is organism regeneration at the cellular tissue level. The problem is you can't measure that in a meaningful way. But what people can see is if their telomeres have lengthened, if their DNA methylation has age-wise has improved, then they get some sense that yes, this is working. But that's not our primary goal. Our primary goal is over a period of time, much like those studies, is to regenerate the entire organism. But we can't measure 20, 30 years from now the output of that or the outtake of that.
I think you answered this, but if you want to embellish, okay. What do you like about True Diagnostic?
What I like about them, I've been with them literally since Ryan started. When he came from Taylor Compounding, TaylorMade Compounding, I had a lot of respect for him because I understood what was happening at TaylorMade, and I had respect for him that he exited that enterprise. Um, and we were using my DNA at the time, but I saw what Ryan was producing, and I knew where he was headed. So it's Ryan Smith is a big part of it. The other part of it is I've been with them now for 4 years, I've seen, as I say, well over 200 test results. They're not all perfect. That is, once in a while, an oddball test result will come in. But on the whole, when I chart them over a period of 3 to 4 years, I can see the progress that we're making, and there is a what I call an authenticity to what I see on the test results. The other thing is that Ryan is constantly expanding at a dramatic rate the whole world of DNA methylation age-related testing. He has partnered with Harvard here recently. They have what they call their omic testing that they've added, which is very interesting. It's in its infancy, and so it has some issues and so forth. But I see that Ryan is really he's the energetic leader in this DNA methylation testing area. The Buck Institute had him speaking recently, and they're doing some clinical studies using True Diagnostic. So it's not just me. I mean, pretty much True Diagnostic is considered to be the leading, at least for biological age purposes, the leading lab in this area.
Okay. Miles asks, have you been working on seeing how these peptides are affecting the genes? And I guess that an answer to that would tell me whether to ask the next part of that question.
Yeah, it's not part of our protocol. Our protocol is, as I've talked about in the YouTubes and so forth, is the biological age markers, telomeres, DNA methylation, tissue organ regeneration. To some extent, secondarily, is the feedback from doctors in terms of patient improvement. That is our very narrow focus. We don't go beyond that. We've been funding this ourselves, basically. We've spent about $1.5 million at this point, and we just don't have the funds. I'm working typically 9 in the morning until midnight, 4.5 days a week. I don't have time to do anything other than be focused on these 140 people. Well, like you, I'm doing a lot of things. I mean, I'm adding things all the time. I'm doing ozone therapy. I'm doing a long list of things and so forth because
Yeah.
I really love waking up. As you know, because we've talked for years and so forth. You ask me how I am, and I say I'm great. I woke up this morning. That's all I need is to wake up. Yeah, because it's the gift of another day. But I expect to have about 25 or 30 or more. Because, in that video, we talk about the bridge. I'm so excited with, what the Buck Institute and the various foundations are doing in terms of research and so forth. The situation is that we've got all these billionaires out there who realize that they've got a lot more money than they have time left. And they've decided to invest that money in adding time to their life. And so, as I talk about in those videos, the peptide bioregulators are not the end all. What they are is they are substances like many other things, stem cells, plasma, as we've been talking about, plasma replacement and so forth, that will keep us healthy so that when all of these foundations finally go from research to practical application, we hope that they will come up with interventions that will add 20 or 30 years. So I'm almost 80. I would love to be 110 and still be highly functional. And I think that's a realistic situation.
Very good. Yeah, his last question, I'm going to save it for the end.
Okay.
And it looks like, yeah, I had asked Walter's question first. Miles was the first one, so there doesn't appear to be any that were asked before him. Okay, Jeff Parker. We have always heard that peptides are rapidly destroyed in the stomach due to breakdown from protease enzymes. Yet the oral natural extracts in your program seem to be producing documented benefits. Please explain the bioavailability of both the natural extracts and the synthetics.
Well, I won't talk about the synthetics because I don't deal with them. at this point. But in terms of the natural extracts, as I mentioned earlier, it's because that short chain amino acids. I mean, when you're talking about, most of the peptides are 2 amino acids, some are 3, and there's 1 or 2 that are 4. When you're talking about a string of amino acids that small, they pass right through, as food. And because they are naturally food products, they're sourced from animals and so forth. The proof of all of that, I could talk about, why that is, but the proof is the results. The results in telomeres, the results in DNA methylation, biomarkers, and so forth. If those peptides were not passing intact and going to the specific organs, because we use the peptides, the doctors do, for specific organ regeneration. And so what they'll do is they've got a kidney patient and we send them a bunch of kidney peptides, and then they do the labs and we see the improvement because they're organ specific. So the overall evidence is the results, the lab results, the doctors telling me, showing me the labs. But the telomere, like for instance, Johnny, for yours, from what, 50 to 29, that's the proof.
Yeah.
Yeah.
And regarding that, I'm learning more about, I mean, I'm not a big telomere fan for its own sake.
No.
Among the hallmarks, let me put it this way, they're all important, but it's farther down in my list of things that I would work on, given the priorities and limited time we have. But I'm learning more and more. In fact, one expert in HTERT gene therapy at a conference told me how HTERT doesn't only extend telomeres, but it has, I think the number was 6 other positive age reversal effects that are unrelated to telomeres. And someone else told me something similar to that before. So there's that.
Yeah,
Okay,
and Johnny, as I said, we use telomeres and DNA methylation because they're an easier markers to be able to process. The cost of them, the processing time, people can understand the numbers that come out from them. But in addition, the telomeres I talk about sometimes are sort of like the tread on our automobile tires. Of the longer telomeres are like having a premium tire with lots of tread on it. You can just go on a longer journey at that point. The DNA methylation for me represents the rest of the car. It's the working components, it's the engine, transmission, and so forth. So one without the other, yeah, I guess you could sort of get along from a biological standpoint, but to have the two of them at a high functioning rate, I want all the cell replication I can get throughout my life. That's why the
Mhm.
telomeres in there. Besides, we can measure that.
Part B, well, you sort of provided a good answer to this, but I'll ask it anyway. Are there any bioavailability studies, bioavailability studies?
I think there are some in Russian done from like 30 or 40 years ago, but I haven't seen any English translation. I only have maybe about 20, at the best, 20% of the Russian studies have been translated at this point. No,
Okay.
I'm not aware of anything current, but the data is the data.
Yeah.
Yeah.
Are there natural extracts in enteric capsules? If so, why not? Or if not, I guess why not?
I don't have an answer to that. Khavinson and the Institute have formulated, the capsules and so forth. Just an aside, in a sense, we're moving the manufacturing of the peptides out of Russia because of the U.S. proxy war against Russia has made it really difficult to make payments to Russia, to the Institute, as well as get product out. I've lost about probably $10,000 in the last 4 months of product that either the FDA has grabbed or DHL has handed over to customs and so forth. So we're moving the manufacturing into Denmark and Britain, and we will be operational by the end of May. So I haven't controlled what the capsule composition has been in the past, and I'm not at liberty to talk about any of the detail of what we're going to be doing going forward.
Okay. Part D, are there any excipients or carriers to enhance absorption?
We don't need any.
Okay,
The data is the data.
okay. Uh, Clifford asked, source of peptides is cattle tissue, including brain? Question mark. Any risk of prions?
No, the the extracts are so carefully processed first in, well, actually entirely in Denmark. And these things have been around now for what, 50 years, not a single case. There are no adverse events whatsoever, other than the only adverse event that we see is sometimes people get a little enthusiastic and they'll take too many peptides too quickly and they'll have some bowel diarrhea. But there are no other side effects whatsoever. And Khavinson,
Very,
yeah, Khavinson has told me that he estimates that um, that they have used more than 2 million boxes of peptides over the last 40 years.
mm. Okay. Pete asks, pros and cons of natural versus synthetic?
Well, in at the Institute, they actually use synthetics. They use injectable synthetics to start with. Then they'll go to oral synthetics. They have about, of the 21 peptides, they have 8 of them in a synthetic form. They're faster acting, but they don't use them on a longer term basis. The natural extracts have a much longer what I call effectiveness to them. So speed, if someone shows up at the clinic in Russia, they're going to use injectables. They'll follow it up with synthetics, but the long term is going to be the regular peptides. But we don't bring the synthetics in because of FDA issues. We don't want to have them classified as drugs.
Okay, Walt asks, can some of these peptides be administered via nasal/pulmonary administration using ultrasonic atomizers?
Yes, they certainly could be. That's not something that we're doing. It's not something that they do at the Institute, but there's no reason. In fact, Khavinson, because we Americans don't understand, I think, very much about it. The war in Ukraine did not start 2 years ago. It started 10 years ago. And Khavinson and I had talked about it. It was clear that there was going to be a war involving Ukraine and NATO and so forth. So he started developing alternatives to the capsules and the injections and started manufacturing companies in other countries, principally in Italy. So we now have oral sprays. There is one of the peptides that's in a nasal spray at the moment. There are 3 of them that are in an oral sublingual spray. And that seems to be kind of the future, is going nasally or sublingually.
Hmm. Okay, and is the correct way to say your name Elaine? Alain?
Yes, Johnny, that is correct. I actually have
Elaine.
because Dr. Bill's really covered this question in the previous few answers, but if I could
Okay.
ask an additional question, it would be, are these animal extracts, are they a cocktail of the peptide, or is it just a single peptide in this extract?
It's a single extract from a specific organ. And so that's why we have 21 of them at this time. We use them as a cocktail in a sense, but they are separate capsules put together. So for instance, we never use just one peptide for a condition. Again, I'm not using them for medical conditions. That's up to the doctors. But at the Institute, and then what the doctors here are doing, if someone, let's say they have a cardio issue, okay, a heart issue, etc. We will use the heart peptide. We will use the arterial peptide called Ventfort. We will probably use certainly the thymus peptide. I would say the cocktail is the using of several of the various peptides to treat a particular problem.
Okay, can I discuss something?
Yes.
Also, I did some work on a peptide called thymosin beta 4, and it was initially discovered through isolation of the calf thymus, and then it was homogenized and an extract was made and purified, and they did electrophoresis and got many peptides from this one extract, one of them being thymosin beta-4. I know there's thymosin alpha-1, 15, and 10 are just other examples. Would it be something similar to this?
Well, the thymus peptide natural extract would be somewhat similar to that, yes. Yeah. Also, there's a lot of synthetic peptides out there, and in my opinion, after investigating them, not using them, they do wonderful things. I mean, it's just they're much more effective than the typical pharmaceutical drug for many, many conditions. We don't use them in the clinical study, again, because we're narrowly looking at the natural extracts. We want to avoid problems with the FDA. Unfortunately, the whole synthetics, as effective as they are probably going to get shut down by the FDA. As I think a lot of you probably know, in August, I think it was, the FDA made a list, issued a list to compounding pharmacies of about 10 or 12 of the synthetic peptides that they could no longer compound. And I think that's sort of the shot across the bow at this point. And unfortunately, some of the promoters here in the US of the synthetic peptides have been a little too, I would say, a little too aggressive in talking about cures and medical conditions and so forth. And that raises all the red flags with the pharmaceutical industry. The pharmaceutical industry is not interested in having these synthetic peptides being made available to the public. And so I consider the FDA to be a wholly owned subsidiary of the pharmaceutical industry. And I see the handwriting on the wall, and I've been warning some of these synthetic people that you got to pull back. You're just creating a potential problem where they will ban all synthetics. And my fear is that in so doing, and I've had this happen recently with the FDA, where they took one of my peptide orders from Russia and they declared there were 8 different peptides in the order and declared them as drugs. They're not drugs, they're food supplements. I had filed a brief 35 pages of documentation from half a dozen European countries showing that they're all classified as food supplements. But the way the FDA operates is once they declare them as a drug, you're done. So anyway, that's sort of the synthetic issue.
Walt confirms the value of true diagnostic, and I'll just say that in my belief, they've pulled into the lead position beyond the others. So that makes 3 of us. Day, I think we'll save that question for later as well. Ellie asks about the protocol for taking the peptides. And specifically, what's the protocol for endolutin?
Okay, the way we set up the protocols is we have people get tested for telomeres DNA methylation. I get those results. I analyze those results. In the meantime, and we're very careful about how we do this, but because primarily we've only been admitting, with a few exceptions, health providers for the last 2.5, 3 years. I think of our 140 people actively in the study, at least 120 of them are health providers, mostly physicians. Anyway, so I have the luxury of being able to talk to them a little bit about their medical issues and so forth. And so they give me a list of medical concerns for themselves. So that maybe they have elevated this and elevated that, or they have a family history of something. So when I build a protocol, I take into consideration the telomere situation, the DNA methylation that's been greatly expanded recently, and also medical concerns that they have. And then I sit down and I'll take a spreadsheet and I pick out of those 21 peptides on a 12-month program, the ones that would be most appropriate. And since we're looking at changing biological age and methylation and related age and so forth, we will use all the peptides over the course of the year, some of them at a higher dosage than others, particularly if there's a medical issue. There are a couple of foundational peptides, and indolutin, or the pineal gland peptide, is one of those foundational peptides that we use in every single program. Most of the time, we're using on a monthly basis, which would be one box, 20 capsules, 2 capsules a day for 10 days. The cycling or the pulsing period is very important. Khavinson figured out a long time ago that these are not like pharmaceutical drugs where you administer them daily. You administer them for a short period of time, and then you allow the organ to function on its own, so that ultimately the organ becomes fully functional, not dependent on a constant intake of the pharmaceutical. So the foundational ones are the pineal gland, endolutin as a capsule, the thymus called Valdonex as a capsule, and probably the arterial peptide Ventfort are in all of these protocols. And then the rest of the protocol is to make sure that over a course of 12 months that there are at least 3 or 4 times in that 12 months that you're taking the bladder peptide, you're taking the cartilage peptide, you're taking the brain peptide, and so forth. Then I create that protocol, I submit it to the participant, to the doctor, and then we do a Zoom call and go over it together. Finally agree on a protocol, and I would say the normal protocol is 5 or 6 different peptides a month, rotating through the course of a year. Then at the end of, not the year, but the end of 13 or 14 months, because we want the peptides to have a full 12 months for absorption and for tissue regeneration, we'll retest. And based on the retest numbers, then I modify that protocol. So that's how the protocols are put together.
What is the protocol when you work for the or a particular organization or organ?
It would be three or four, typically 3 or 4 different peptides. Let's take a retina problem. A retina problem would be the vision peptide. We now have the vision peptide as both a sublingual liquid as well as the capsules. And for someone that has retina issues, we will use both. But we also will always use the brain peptide. We will also always use the pineal gland peptide, the thymus peptide, and the arterial peptide. So there would be 5 or 6 different peptides for a serious retinal issue, for instance.
Very good.
Why I ask about protocol, it's because usually any particular peptide used like 2 capsules a day. Is it right, Bill?
Yes, are you talking about indolutin?
No, any peptide, when you usually take twice a day or two capsules a day.
That is
right?
correct. That is correct.
Yeah. Why I ask about indolutin, because they have different protocols. So well, this is what I am asking. How do you use indolutin? Because my understanding, Khavinson recommend to take it every 3 days.
Every 3
2
days?
capsules every 3 days, yes.
That's news to me. In a sense, it does not matter. I say your question matters, but it doesn't really matter in a sense, the dosage, because since these are natural extracts, you can't overdose. In other words, a person could take 5 of the indolutin every day, probably for the rest of their life, and there would be no adverse effects. When I was speaking in Sweden, I think it was, or Stockholm, a doctor, after listening to that, he stood up and he said, "What you're really talking about, Dr. Lawrence, is nano steaks." And it took me a moment to understand what he was saying. He was saying these are little amino acids food, and so you can't overdose anybody. But the program normally for most people will be 2 capsules of the indolutin for 10 days, off for 20 days. But that's only a starting point, because let's say a person has a lot of issues, and the pineal gland peptide is used for that. Particularly the pineal gland peptide indolutin is really good for telomerase activation. It's the primary activator. And let's say that they're 100 years old, basically, in terms of telomere length when they come into the program. I would probably use the indolutin for that person, and they have maybe some other issues that would be appropriate. I would probably use 2 capsules a day for the first 60 days consecutively, and then I would start reducing it thereafter. Let's say that someone comes in and they've got vision issues or retina problems and so forth. Serious, or no, let's take Parkinson's and let's take Alzheimer's and so forth. They've got a diagnosis of Parkinson's, Alzheimer's. I will use 4 a day of the brain peptide. This is in conjunction with the doctor. I won't do this for the non-doctor, but I would use 4 of the brain peptides, the arterial peptide, the pineal gland peptide, the thymus peptide, probably the liver peptide. But I would use 4 of the Cellular, the brain peptide, every day for probably 2 months. And then I would start tapering down. The luxury that we have, and again, I'm getting into treatment. I need to get sort of away from that. The luxury that the doctors have is you can't hurt anybody. You can't overdose them. Now, at the same time, you don't want them to always be dependent on the peptides. And so that's why at some point you go to maybe the endolutin for, let's say, biological age might be used after a couple of years, like Johnny's getting to this point, okay, where we'll probably just use a box every 3 months or every 4 months. Hopefully that makes some sense.
Okay.
Ellie, if you have any other questions later, don't hesitate to contact me or Dr. Lawrence, or preferably both of us if you're going to go to him, and we'll get them answered for you, okay? Okay.
Thank you.
Walt asks, can the therapy, at least in part, affected by eating organ meats?
It can't be negatively affected. In fact, we purposely tell people you don't change anything else. If you're enrolled in the program, you do what you're doing in your life. The diet doesn't change lifestyle. We don't want people to change because we're just simply adding these on. But yeah, organ meats, that actually, if we went back 1,000 years, medicine was pharmaceuticals that didn't exist, of course, until Rockefeller was looking for something to do with his excess oil stuff. And what they used was plants and animals as their medicines. I think I just read a study recently or an article. They've identified almost 100 different animal products that were used as medicine 500 years ago, and so forth. So adding organ meats is great. There's no clinical studies because there's no money in it to show would organ meats do the same thing in terms of telomerase activation and DNA methylation modification. I suspect not, because the makeup of those organ meats is in terms of large proteins. And so we all know that a large amount of that's never going to pass through blood-brain barriers, et cetera, et cetera. But yeah, eating organ meats is certainly fine. That's actually where this all came from, was from animal foods.
All righty. Next question in a moment. Okay, Walt advised the general problem that applies here is the effectiveness and risks of taking more than one item at the same time. Any comments?
Well, I'm not sure I really understand the question. Our goal is we're not interested in figuring out if there's one peptide that is more effective than others. And what we're doing is saying that we can use a whole bunch of peptides specific to organs to basically regenerate the human organism, at least the major organs and so forth. So we're not trying to figure out if we use the brain peptide over a period of 4 or 5 years, is there improvement in brain function and so forth. Given that we've got 21 peptides, we'd be talking about 100 years to do that. And again, our goal is not to show that the peptides are effective by themselves as organ regenerators. what we're doing is showing by using these proxies that we can regenerate a human's organs such that they will end up with a lot less medical issues and a lot longer life. So I don't know if that addresses the question, but we're not trying to prove one peptide is superior to the others. We're using them for specific organ regeneration.
Yeah, Walt, did that do it?
Just curious if there's a lot of, for instance, when I take a multivitamin, for all I know, I'm poisoning myself by mixing these things at the same time. There's very little data on that, and I just wondered if there's any knowledge in this area, but I think the answer is no.
No, there really isn't.
Yeah.
It would be like sitting down and having a steak, and you decide to add, I guess, some lamb to it as well. Or maybe, no, that's not a good metaphor. Let's say you're sitting down and eating some organ meats, okay? You're eating some liver, you're eating some heart and so forth. They're probably all helpful. If you were doing a clinical study to figure out, does the liver itself, the liver meat, do certain things, that would be legitimate. But that's not what we're trying to do. We're just simply saying the group of these peptides will produce a biological age impact positive as well as a DNA methylation age-wise positive.
Okay. And Pete asks, are the individual organ peptides a mixture of many different peptides?
No, they're purely extracts from the specific organ. So the sirtuin, which is the brain peptide, only has brain extract in it. The pineal gland, the same. The liver, the same.
Okay. And Cliff, or Clifford, if you prefer, through a couple interventions over the past 4 years, I've reduced my epigenetic clock age by 15 years. Whoa, I'd like to know which clock, but enough sidebars. Would peptide therapy likely be additive to this?
Yes, based on 200 and some odd tests, 140 some odd participants, 7 or 8 years at this point, I can say confidently, yes, they would be a nice adjunct to other things that you're doing. I'm become very excited through Johnny in terms of plasma exchange, and that is something that should be added to the peptide program. You remember what I was saying about crossing the bridge? You do all of these things, including the peptides and so forth, to keep us all as healthy as we can be, such that when the Buck Institute finally comes up after billions of dollars spent on something practical that we can use, that we're available and alive to use it.
Or a group I'm working with here in Florida, working on Yamanaka factors, OSK.
Yeah, all of that
More
stuff,
about
Johnny.
that later.
Yeah, I mean, we want to grab everything that's reasonable, particularly guys like you and I, in those 70s. We don't have the time to avoid, we need to grab everything that has some science behind it and start doing it or continue doing it.
TikTok.
Yeah.
Pete asks, are there any biopsy studies of organs before and after?
No. At least not here. There may be the Russians probably over 40 years. They used these back in the late 70s was when they started using them, and they used them in military people. And I suspect they probably would have that kind of information because Khavinson was given a free hand and basically a blank checkbook in terms of expenditures of money. So he probably did those kinds of things, but we don't have that information.
Day asked, how do we get access to the peptides?
Well, it's difficult right now because of the U.S. proxy war. None of the suppliers, there have been 2 good legitimate. Well, let me back up. You have to be careful because there is a lot of counterfeit, like there is in the pharmaceutical world. There's a lot of counterfeit bioregulators out there. They typically come out of the former Soviet Union countries, Eastern European countries, and so forth. So if you go online, you'll see probably at least six or eight different vendors. claiming that they're selling peptide bioregulators. The only two that I know for certain that are selling actual Khavinson peptides is a company called VitaStream, VITA, VitaStream, up in the Seattle area. They've been at it a long time. They're a credible company. I've met the owners and so forth. The other one is Phil Mikan at Profound Health over in London. Both of those are credible, reliable sources for real peptides. Everything else is either I don't know about it or very suspect. Right now, it is very difficult to get any of the bioregulators because, again, the mandates and the sanctions and so forth. That's why we're moving the manufacturing to Denmark and Britain. That'll be operational, as I say, in May. If you go to VitaStream, they do have a few of the capsule peptides. They also sell some synthetics there as well. And they do have a few of them, but I noticed that their inventory goes up and down. So that's where you're going to get them at the moment. I bring them in through a lot of trial and tribulation from Russia. We have to send them to either Kazakhstan or we send them to Singapore, and then they turn around and drop ship them to me here in Atlanta. It's a difficult process, and as I say, I'm losing probably maybe 15 or 20% of the orders get confiscated by either customs or the FDA.
I hear you talk about a study that would be done in the United States in the future.
Yes, Pete. What sold Khavinson? Khavinson was not a fan of the American medical industry, as he called it, as well as the pharmaceutical, as well as the FDA and so forth. So he had no interest in ever doing anything over here. But it was the idea of that we would be able to publish a study. That is still the goal. I've sent all of the telomere data into the Institute about 4 or 5 months ago. We're hopeful that they will publish sometime in 2024 the telomere data. The DNA methylation, we probably need another year to have at least a 3-year data bank. And the reason I say that is that we find that with the peptides, Pete, that it takes, I can change people's telomeres in about 12 months, pretty dramatically, 14, 15 months. The DNA methylation takes longer because we're dealing with the entire organism. We're dealing with all the major organs. I think we have, 78 major organs or something like that. And we have 21 peptides that are directly dealing with these. I don't see a significant change until about 18 to 24 months. So, but I need to have then at least 3 rounds in order to publish, not just a before and after. I need a before baseline, I need a 2-year after, and I need another 2 years after that. So we're probably a year to 2 years away from publishing the DNA methylation stuff. And where we will publish, I don't know. Probably originally it'll go in a European publication, and then at that point, we'll see if we can't publish in an American publication or maybe a British.
Okay.
Okay. Clifford and Jeff asked basically the same question, and part of it has to do with Miles' question. It's basically, how does one join the program? And normally, yeah, ditto Jeff's question, please, from Chris. Normally, on our YouTube video, I've agreed to first take calls and inquiries and screen them. Dr. Lawrence Bill is very, very busy these days, so I do that for him. And I'm going to tell you, I don't do that for just anybody. I only do that for some project and a person that I've met face to face personally and have really believe in and have my own results with. And I let them know more about the 2 levels that there are and what the cost is. Unfortunately, it costs something. And then if they want to move ahead, I connect them with Bill. So the two questions, yeah, how do we get access and how do you join the program? What's the cost? Do you want to take that now, Bill?
Sure, be happy to. How you connect, I go out of my way not to be available because a long time ago, I was an entrepreneur for 10 or 12 years, and I was building shopping centers, medical buildings, radio stations, cable systems, retail stores, and so forth. Worst period of my life. I'm not built to be an entrepreneur. I'm built to be a hermit, basically. And I finally, when my father died, I changed all that. And this is 30 years ago. And so I really work hard to try and balance my life. And I work like an obsessed, crazy man Monday through till Friday afternoon. And then I leave that area. I live in the Buckhead area, and I travel 20 miles to where my significant other of the last 14 years lives. And we have a quiet weekend where I try not to do any work. And it's sort of the balance. And so I've asked Johnny to screen inquiries, and he's done a great job for me. And the way it works is if you're interested, contact Johnny. Johnny will make a decision as to whether or not it should be passed on to me. We're not actively looking at this point because I basically just don't have the time. Although Johnny, I finally hired an assistant, and that has been a wonderful gift. She's just really been able to take a lot of time off for me. Anyway, here's the cost structure. First, let me also indicate the clinical study. I take no compensation, no salary whatsoever out of the clinical study. I fortunately made enough money and have not been married and divorced 3 or 4 times to deplete that. I made enough money during that horrible entrepreneurial time where I don't need to take anything. We do charge, and the monies that come in are used to pay the expenses of the clinical study, pay for the peptides that we are sending out all the time, and the excess until recently is sent over to the Institute to fund their future research. Unfortunately, because of the U.S. sanctions, we haven't been able to send any money. It's sitting in banks over in Europe until we can send money into Russia. The cost at this point for a health provider to enroll, to have test results done, for me to create a protocol is $10,000. Then the additional, and that covers their full participation for 3 or 4 years in the study. The only additional costs they have are the supplements, the peptides. The average, let's say, is probably about $300 a month, maybe $400 if they have several medical issues that they want to deal with. And then the retesting, and the retesting is, we only charge the cost for the retesting. It's running about $700 for telomere and DNA, and that comes around every 13 or 14 months. For a non-health professional, because they require a lot more of my time over a period of 3 and 4 years, the cost is $25,000. We'd pay a referral fee if someone sends us what we call a concierge person who's paying $25,000. We send them give them a referral credit or pay them $2,500 for the referral, because we don't do any marketing, we don't have a web page, etc. We grow by having those referrals, and I'm not sure that we want to keep growing at this point because I'm getting close to maximum. But that's the present situation. So you need to contact Johnny.
And I'm going to add that when I talk to people, I fully disclose that I get my referral fee in the peptides. And if there's an overabundance, any money, I would not take money. I let the person know that if they're not comfortable with that, well, I'm here to help. Just reflect that. I'll reflect that back in a reduction in the cost in the peptides. But everyone I've talked to said, no, that's okay. You're playing a part in this. But if any money is involved, it goes to my 501c3 nonprofit foundation to fund the many, and I mean many, they're mounting now, having moved here to Florida, expenses to fund our research and solutions development. Walt, are there any peptides that affect mitochondrial activity?
The answer is not specifically, but when you're regenerating at the cellular tissue level, primary organs, I would think that there would be some carryover from that, but there's not a peptide specifically for mitochondria. Functions, epigenetic changes, yeah. Stem cell fate, yeah. In other words, if you enhance the entire organism, I think logically you would say that you're probably enhancing all the systems as well. Let me add, Johnny, one other thing, and that is, as I mentioned it earlier, I'm really concerned that the FDA is going to come down, the pharmaceutical and their wholly owned subsidiary is going to come down hard on the synthetics. And my fear is that they're going to engulf the peptide bioregulators, because when I sent my multi-page brief and 35 pages of documentation to the FDA, I'm sure the guy didn't even look at it at that point.
Mhm.
And so my concern is that we're going to get caught up in the net of the synthetics, and the peptide bioregulators will be declared as drugs rather than food supplements, even though the documentation says otherwise. So I don't know how long this is programmed and this is going to be available in the United States. We are expanding a little bit. I'm speaking in Mexico in a couple of weeks, and there's a compounding pharmacy there that wants to expand all over Central and South America. It may be one of these things, unfortunately, that sometime in the future that you can only access out of South America, Central America, bring them back and so forth. I'm hoping that isn't the case, but that's sort of a problem that we're looking at.
Our group is developing relationships in the Bahamas and Jamaica. So
Yeah.
there's that.
Yeah.
I think I see another question. Can you provide a link to the best available summary research paper on this subject? That's from Walt.
Well, yeah, there's a couple of overall papers, 35, 40 pages long, as I recall, that Khavinson wrote some years ago. Johnny, I could send those links to you, and you can distribute them if you're willing to whoever's interested. And they have a lot of clinical study information in them. Yeah.
Okay.
Khavinson has well over 700 publications out there, but there are a couple that are kind of a nice overview.
Outside your study, are there any clinics outside Russia that are doing the eye disease treatments with bioregulators? Are any Americans still venturing to St. Petersburg for treatment?
Let me answer the latter one first. It's very difficult for an American to get into St. Petersburg these days. I get in with a medical visa, but just the tourist visas and so forth are impossible to get it right now. There are individual doctors there. As far as I know, there's not an eye clinic per se that is using peptide bioregulators. There are individual doctors, functional doctors, who are using them for many different issues in terms of the patients that they see. And I'm sure they would be open to discussions and patient referrals and so forth. There's several particularly in Florida that I'm thinking of. But there's not an eye clinic per se that I know of in the United States or outside the United States, outside of Russia, that's doing what the Eye Institute. There's actually a specific Eye Institute in Russia, in St. Petersburg, that's dealing only with retina issues. But I'm not aware of anyone else.
Nicole asks, what kind of results have been obtained with use of eye peptides?
What I hear from the doctors is that within about a year, typically, progression has stopped at that point. And then thereafter, based on eye scans, improvement. I have my personal situation is I have two, and I think I mentioned this in those videos maybe. I have two young boys. This is like 10 years ago when I was first introduced to the peptides. Both of the brothers in their young teens, both of them diagnosed with RP within a year of each other. And because of friendship, and all that stuff, the referral person sent the parents to me. We put them on the vision peptides. I get their annual scans. At this point, within 6 months, their night vision improved. There has been no regression whatsoever from their baseline. And of course, their ophthalmologist never asked them, "What are you doing?" To that. So for 10 years, they've had no regression, no loss at all of vision and so forth. But the only other sources that I'm aware of are a few doctors mostly in Florida that are using them.
Any other questions? Going, gone, unless you think of one. Should we shift to a general discussion?
Sounds like it's time for me to exit, Johnny.
It's been great. Thank you.
Okay. Yeah, you bet. Enjoyed it all as always.
Bye.
Okay, bye.
Okay.